SI joint pain or sciatica making you hate your pregnancy? Join me for 5 stretches that are going to give you relief from sciatic pain. During pregnancy, your SI joint can become sore and misaligned, and that can result in anywhere from grumbly achiness all the way up to sharp pain. Join me for 5 stretches that are going to create a lot more ease and comfort in your body. So the first thing you're going to need is some props. So if you have a yoga block, either like this or like this, either kind of yoga block is going to be really helpful. But if you don't have a yoga block, I wanted to show you something that you can do just with what you have around at home. So you can either use a really good box like this that's like really firm and can take some weight, or you can pile up some books and that will work too. We do want a little bit of cushioning, so I folded a blanket just to put on top. So join me on your mat and we're gonna get into bridge pose. This is pose number 1. So for bridge pose, I'm just gonna lay on my back, which is totally okay for pregnancy if we're not there for too long. All right, and I'm gonna lift up my hips and I'm just gonna slide my prop right underneath here, right underneath my hips. And the first thing we're gonna do is we're just gonna take 5 deep breaths here. Now, if things are really misaligned in the SI area, it may help to get additional support. Stick around to the end and I'll share who is the best person to go to. Inhale, settle. Exhale, release. Inhale, settling into the pose. Exhale, release. Now, oftentimes when we have troubles with the sciatic nerve, it will be an asymmetrical problem where there is more soreness on one side than the other. So if that's true for you, I want you to bring up the knee that feels of the sore side, of the side that feels more sore. And this foot can just stay on the ground and we're just gonna hold the knee up. And we're breathing into that stretch. And, you know, if you're pretty far along in your pregnancy, you're going to have a big baby bump right here. So it is okay for that knee to go a little bit more out to the side to make room for your belly. Totally okay. And then we're going to release that side. We're going to bring up the other side, grab hold. And here again, we're doing those 5 breaths. If you can, think about breathing all the way down to baby, all the way down to your low belly, creating some nice full breaths. And because we want to create balance in an area that was unbalanced, we're actually going to do the sore side, the other side, and then the sore side again. So I'm going back to that sore side. So I'm actually doing a little bit more stretching on the side that needs it more. This is how we create more balance in the body. And if both sides happen to be equally sore, then just do an equal amount of time on both sides. That's totally okay as well. All right, from here, there's 2 options. Option A is you're going to stretch your leg out and move your foot from left to right. I'd love for you to just test that out. If it doesn't feel good, if it feels way too ouchy, then here's your alternate. You're going to keep the knee bent and you're going to slide the foot from left to right. So just choose whichever option feels better for you today, and this might be different today from tomorrow, and that's okay. Things can change quite a bit from day to day during pregnancy. All right, then we're gonna switch sides. So again, either with the leg extended, if it feels good, just sliding the foot from one side of the mat to the other, or doing that alternate version with the knee bent. And just like we did with the first stretch, we're gonna go to that sore side once more. So if this is my sore side, I'm gonna do my sore side a second time. As you're moving your leg across from side to side, you might actually notice that this is a little bit of a core workout. And making sure that we maintain our core strength is really important in pregnancy. Then I'm going to come back to center. I'm going to take a nice full breath here, just kind of let everything settle. Then I'm going to stretch my arms overhead. This is a wonderful stretch for the chest and the shoulders. Some of my yoga ladies call this one get your boobs off your belly pose, because sometimes in pregnancy it can feel like there's just no space between them. So one more full breath here. Wonderful. To release out of this posture, this bridge pose, we're just going to lift our hips, slide that out of the way, and then we're going to bring our knees up. This one's sometimes called teddy bear pose. And we're going to keep our knees nice and wide to have lots of space for baby. And we're just going to rock here. Just gently rock from side to side. And we're going to pair this with happy baby pose. Happy baby pose is similar. We're just going to stretch our legs up. You can grab hold of the lower legs, the ankles, or even the sides of the feet if it works in your body. So wherever you're holding on, and then again, just gently rocking. This one is called Happy Baby because babies naturally do this pose quite a bit once they discover their feet. And it's a lovely foot pose in pregnancy because it's like a little massage for your low back. All right, from here, we're just going to give everything a nice big stretch from tip to tip, then roll to your side, come on up, and we're going to move into tabletop position. So just on all fours, going to give it a nice little shake. I like to call this one the happy puppy. So good, just letting the belly hang. And then we're going to move into pigeon pose. So pigeon pose is a wonderful stretch for the SI area. So you might, if you're pretty far along in your pregnancy, you might just stay right here and just rock from side to side. In fact, rocking from side to side is a great idea. If you want to go a little deeper, let me just move these blocks out of the way. If you want to go a little deeper, you can grab that prop that we created and you can rest your forearms on it. But if it feels too squishy, don't worry about it. And here again, we're going to take 5 breaths. So we're inhaling, settle, exhale, soften. Inhale, settle, exhale, soften. And just like we did with the bridge pose, we can actually do sore side twice. Again, that just helps to bring more balance. So I'm rocking. I can stay up here or I can come on down, whichever feels better. Oh, and just in case we haven't met, I never introduced myself. So I am Marie. I love all things pregnancy and birth. I've been a prenatal yoga instructor for the past 20 years, and I love providing you with ways to help your pregnancy be easier. because I know it can be a challenging journey. All right, so let's go back to that original sore side. Again, if things are equal, just do it equally on both sides. But if you do have a sore side, we're going back to the sore side once more. Inhale, soften. Exhale, ease. And then we're going to finish up with a wonderful pose for relaxation that is actually going to help with the sciatic area. So if you have time, I want you to go up here, click on that link, and listen to the full 10-minute long relaxation. If you don't have 10 minutes, just stick with me. We'll just do about a 10-breath relaxation. And so you're going to take your prop, you're going to lay down on your side. You can use a cushion under your head or just your arm. We're going to place this in front of our hips, and our bottom leg is going to stay relatively straight, and I'm leaning forward onto my support. And I'm just going to rest my head here. And we're going to just take some nice full breaths. Now I know this pose doesn't look like much. In fact, it might feel as though you're doing nothing. But this is actually a wonderful release for the sciatic area. It's helping to release the hip, the muscles in around the hip, so our hip flexors and hip rotators are softening. I would suggest that you do this with the sore side on top. And it's also giving this wonderful but really gentle stretch to the big back muscles that are going across your back. So the ones that are going from the spine and then attaching into the hips. And as you inhale, soften. Exhale, relax. Inhale, soften. Exhale, relax. And then to release out of this, you're just going to make sure that you're using your hands to lift you back to a seated position. And a lot of times what you'll find is when you come out of doing these stretches, as everything just kind of moves back, things will come back into a better alignment. Now, if there is really some bones that are really out of whack, these stretches may not be enough to pull them back. If they're just a little out, the stretches might be all it takes. But if you do these stretches and things are still sore, you may actually need to see a care provider. So I promised at the beginning I would give you some recommendations. Now, there are a number of different care providers that can be really helpful for this kind of sciatic issue. So my favorites are massage therapy, physiotherapy, chiropractic care, or osteopathy. Now, in terms of which one I think you should go to, I think you should start with the care provider that you already know, like, and trust. And my other caveat is I want you to choose someone who loves working with the pregnant body. The pregnant body is not the same as your body when you are not with child. It does really make a difference. And so you want to find a massage therapist or a chiro or a physio or an osteopath who also understands what the pregnant body is doing so that they can really give you the ideal treatment, and they have the props that you need to feel comfortable while they're doing that treatment. Now, if you enjoyed this video, I invite you to join me in this next one, and I'm going to share all about how you can use an exercise ball to build core strength and prepare for labor.